Welcome, everybody. This is Mrs. Ignacio with some information about microbiology. Some of you expressed concern about your microbiology class, and I just want to give you a kind of an overview, give you some resources, and kind of test to see where you are. So when we think about microbiology, we need to understand the early history. I'm going to list some names of individuals that you should know who they are. If you're not sure who they are, please refer to your textbook. Robert Hooke is going to be the first English scientist that I'll mention. Robert Hooke. You also need to know the Dutch scientist Anton van Leeuwenhoek. Anton van Leeuwenhoek. He was very instrumental in the observation of microscopic organisms, and he called them animalcules. Also, Francesco Redi. Francesco Redi, you should be familiar with him. And also John Needham. John Needham. Lazzaro Spallanzani. Lazzaro Spallanzani. Also Louis Pasteur. Louis Pasteur. So he's very instrumental, and you may think, oh, pasteurized milk. Yes, he had something to do with that. Okay. So we also want to make sure you look up Robert Koch. Robert Koch, and that's Koch, and understand what's I think it's actually Cook's postulates. So these are things that you should know, these individuals you should know, and you should be familiar with them. Okay. So when we think about microbiology, it's important to talk about pathogens. Okay, so let's jump right in. So these are some of the terms, and as you are studying throughout your time as a college student, you should always look at the objectives in the beginning of the chapter, look at the bold words, and after you finish reading the chapter, make sure that you can list or describe those learning objectives that are at the beginning of the chapter. Also, make sure that you understand all of the bold words. If you do not, this is a great opportunity for you to go to your classroom instructor and ask questions and say, I was reading this in the chapter, but I didn't quite understand. Can you give me some clarification? And I'm sure your instructor will be more than happy to do that. Okay, so we're going to get into our discussion of these key terms: microbes, pathogens, bacteria, virus, fungi, protozoa, rickettsia, and helminths. Okay, so when we think about microbiology, we have to understand that microorganisms are teeny tiny organisms, and they are very small. We can only see them with a microscope. Okay, and so microorganisms can also be called microbes. And so most of the microbes are not harmful to humans, but the ones that are harmful are called pathogens. So pathogens are disease-causing organisms. Okay, so let's get into how pathogens are spread. Pathogens can be spread by four main methods. So direct physical contact, indirect contact through the air, indirect contact by objects, as well as disease vectors. So when we talk about direct physical contact, that means us coming in contact with infected skin, bodily fluids, right? When we're touching our patients and they have an oozing wound, or by sexual activity, right? So that is direct physical contact. That's why we implement universal precautions. Treat every patient as if they have a condition that you don't want to bring home to your families, okay? So hand washing is going to be important, wearing gloves, masks, protective equipment. Now, there's also going to be that indirect contact through the air. So when we cough or sneeze, even when we speak, we're releasing droplets into the air. And if those droplets are infected with, for example, coronavirus or the tuberculin virus, right, then we can transmit those infected particles to other people. Okay, so through the air is indirect contact. Now, direct contact can be transmitted, and that's by inanimate objects like pens, like your keyboards, like doorknobs. Those objects are called fomites, and they can serve as a way that we can spread these pathogens, okay? So also disease vectors is the fourth way, and we can have a mosquito, for example, that is infected with the Zika virus. And if that mosquito bites you, then you may become infected. Many years ago, the Zika virus was a real cause for concern, as that Zika virus was inside of these infected mosquitoes. And for pregnant women, these mosquitoes could actually pass on the Zika virus. And the problem is Zika virus can lead to microcephaly, which will be a small brain, right? Small head, reduced cognitive abilities in the developing fetus. So that was a real cause for concern. Okay, so those are the four main methods that pathogens can be spread. So you may be wondering how these pathogens, sorry about that, how these pathogens cause disease. So these pathogens, they actually rapidly multiply. So they crowd or they kill out our healthy cells. And in the middle, you see a human, which is the host, right? And so unfortunately, when we were looking at this, we become the host for these pathogens. So pathogens can also destroy our cells. The pathogens can also produce toxins that interfere with the normal functioning of our cells. And pathogens also compete with our normal healthy cells for resources, nutrients. And so if our cells don't have enough nutrients, they will not survive. So here's some ways that pathogens can enter the body through open cuts, wounds, bites. So here's an NCLEX kind of question. If a patient comes to you, or if there's a needle stick, if there's a bite or a wound, the first thing that we need to do is wash it with soap and water. That's going to be very, very important. We can also have pathogens enter our body if we inhale these airborne droplets. If a patient drinks contaminated water, sometimes I've seen NCLEX questions with a patient that maybe is taking a vacation in an underdeveloped country and they don't have fresh, clean running water, and they end up with, diarrhea because they are drinking that contaminated water. Also, the same goes with contaminated food, right? So it's important to teach our patients to properly prepare food. Also, direct physical contact as well as sexual activity. So these are all ways that pathogens can enter the body. Let's take a look at the different types of pathogens. My PowerPoint has 6 main types. Your textbook may have 4 or 5 main types, but go with what your textbook states. So the main ones that you definitely need to know are going to be bacteria, viruses, fungi, and your protozoa. And the rickettsia and the helminths, we need to know what those are as well, but your textbook may have it under a different classification. Okay, so bacteria, they're single-celled microbes. And they're alive. And so the bacteria you see here has a flagella. That's how it is able to move. And viruses are tiny non-living particles. Okay, and so when we think of viruses, I know we all know about the coronavirus, the influenza virus. The next type of pathogen is a fungi, right? And this is a plant-like organism. It can cause athlete's foot, ringworm, thrush. So that's important to understand for fungi. And your protozoa, these are microscopic animals, and they are single cell. And examples can be malaria, is caused actually by that parasite, dysentery, and then Chagas. So the rickettsia is a very small non-mobile bacteria, and it can cause the typhus or the Rocky Mountain spotted fever. And then we have your helminths, right, which are your worms. These are parasitic worms, and they are multicellular. And so these examples will be tapeworm and hookworm, okay, which is no fun at all. So the thing with bacteria that you have to understand is that they're single cell organisms. They don't have a nucleus. They do rapidly multiply, and some of them may damage cells directly. Some can release toxins, and antibiotics are going to be what we use to treat our patients that have a bacterial infection. Now, you have to understand that we do have good bacteria and there are some bad bacteria, right? So if the patient is infected with a bad bacteria, something that can cause illness, antibiotics are going to be the way to go. Something that you may have learned about in your class is that there's positive, gram-positive bacteria and gram-negative bacteria. Why is that important? Well, let's put it into the clinical setting. If your patient has some kind of bacterial infection, we as a nurse can take the culture and sensitivity, meaning that we will get a sample of maybe that exudate, what's oozing out from the patient, right, from their wound, or we might get a culture of their sputum, right? So we get that that sample, and it's going to be sent to the lab for culture and sensitivity. In the meantime, we may, or the doctor may, start the patient off on a broad spectrum antibiotic. Okay, once we determine what type of bacteria the patient is infected with, and that usually takes at a minimum 48 hours, because we're going to inoculate that petri dish with agar, and that bacteria is going to start growing, right? Each little dot that you see in that petri dish is going to be a colony of bacteria. That bacteria will then be examined under a microscope and will determine if it's gram-negative or gram-positive. Why is that important to know? Well, that's going to determine the type of antibiotic that is going to be prescribed by the healthcare provider. So that's going to be important. And once you get to pharmacology, you'll take a closer look at that, okay? So that is bacteria, okay? But we only administer antibiotics for bacteria, okay? All right, let's take a look at viruses. So viruses are non-living, and they are much smaller, and they need a host, and they cannot be killed by antibiotics, right? So that's why we're going away from giving antibiotics to everyone. We only give antibiotics if there's a bacterial infection. So you may be wondering, well, what do we do if a patient has a viral infection? A lot of times we just have to let that virus run its course, right? And it could be anywhere from a week to 14 days that that virus is running its course. And we will also treat the symptoms as well. Now, we do have some antiviral medications, and we do have vaccines, because vaccines will help to prevent the infection of this individual, of our patients, with this particular virus. The body will have an immunity to the particular virus. Okay, so let's now talk about fungi. Okay. So fungi, they're simple organisms, and they grow in thread-like filaments, and they are not killed by antibiotics. They are actually treated with antifungals. So think about if you ever had, or if you know of anyone that ever had athlete's foot, which is a fungus, right? It's tinea, right? So the tinea pedis, that is treated with an antifungal ointment. If you have a patient that has thrush, right? That is a fungal or yeast infection of the mouth, and that can be the patient can actually get thrush if they're using oral inhaled corticosteroids, right? So that is like your Flovent or your Advair. So that's why it's important to rinse their mouth after using those medications, okay? So just trying to give you some real life examples, especially as you get deeper into nursing, so you can understand why it's important to have a good foundation in microbiology. All right, when we look at the protozoa, they're single-celled animals. They're more complex than bacteria, and they're found in decaying matter, contaminated water, and they may have this thread-like flagellum that whips back and forth, and that's how they move. And some of them are pathogenic, right? So when we think about malaria, dysentery, sleeping sickness, and Chagas, that is those are some examples, okay? Now, the rickettsia, so this is non-mobile spore-forming bacteria, and so they're transmitted by the bites of fleas, ticks, mites, and lice, and they can be killed by antibiotics, okay? So that's important. All right, your helminths. So these are multicellular. They have many cells, right? And they are parasites. So they can be called worms, right? And so by eating contaminated food, contaminated water, or sometimes even walking barefoot in an infected area, those worms can get into the skin and then get into the body. So that was a quick whirlwind tour of those different kinds of pathogens. I'm going to pause here to see if there's any questions. Okay, I see that there's no questions. We're going to get into the stages of infection. Okay, sorry I forwarded too fast. So the stages of infection. So these are all words hopefully you have seen so far in your class, and if not, you definitely need to know these terms. When we think about these words: infection, disease, communicable, contagious, signs, symptoms, endemic, epidemic, pandemic. We need to know what these words mean. Okay, so let's talk about the first few. Okay, so an infection occurs when this pathogen, remember, disease-causing organism, enters the host's body. When we say host, excuse me, we're talking about us being humans as the unfortunate host. So a patient has an infection when the host enters and then begins to multiply. So let's put this into a clinical perspective. How do I know my patient has an infection? You may be wondering, right? Well, one of the first signs will be fever. So if the patient has an elevated temperature, if the patient has an infected wound or a site of infection, it may be warm or red to the touch, right? So there may be drainage or exudate that is purulent, meaning that it is malodoriferous, it smells bad. It may be green or brown, and it looks really kind of gross, right? So those are signs that the patient has an infection. And that is part of the body, right? That fever is part of the body's mechanism to fight the infection. Now, a disease occurs when these host cells, that human cells, are damaged as a result of the infection, and then creating the symptoms of, the symptoms that we mentioned. Now, the symptoms are going to depend on the infecting organism, and it's also going to depend on that individual's immune system. And this is something that we have seen with COVID-19, right? That this, even though it's the COVID virus, right? So it affects different people in different ways. Okay, so the symptoms may present differently in different patients, okay, based on their genetics, based on their lifestyle, based on their health status. Okay, and that also is going to affect the severity of the disease, right? It's going to depend on the pathogen's strength and the host's ability to fight. Okay, all right. So let's look at the different types of infections. Okay, you definitely need to know this, not only for microbiology, but as a nurse, a practicing nurse, we need to understand. There's pathogenic infections, and so this is an infection due to a disease-causing organism. Opportunistic infection is seen when your patient has a reduced or lowered immune system. For example, your HIV patient, your chemotherapy patient, right? Your patient that may have is taking immunosuppressant medications because they are an organ recipient, right? Opportunistic infections. Examples of opportunistic infections can be tuberculosis, Kaposi's sarcoma, pneumonia, right? Those are all examples of opportunistic infections. Now, an exogenous infection is an infection that originates outside of the body, and an endogenous infection, it originates inside the body. Now, your HAI is going to be hospital-acquired infection. You may also hear it called a nosocomial infection, right? In a clinical setting, a big thing that we're focused on is CAUTIs, right? When we think about your patient that has a indwelling urinary Foley catheter, there can be hospital-acquired infections in that way. So we want to take every measure that we can as a safe nurse to prevent our patients from getting those kinds of hospital-acquired or nosocomial infections, okay? Let's talk about the difference now between communicable versus contagious, okay? So these infectious diseases, right, they're transmitted by other organisms, right? They're transmitted to organisms by these pathogens. If something is a communicable disease, right, that means that this infectious agent is being able to be spread from one person to another, right? Then it is a communicable disease, okay? So if we have direct contact, then this is a communicable disease. Something that is contagious, that means that it's easily spread, right? So if I might not have direct physical contact, but if I cough or if they use my pen that may be a fomite, then they can end up with this particular disease because they have acquired that pathogen. Okay, that pathogen was transmitted. Okay. Let's talk about signs versus symptoms. This is a very important concept for you to understand. You will see this when you talk about the nursing process, when you talk about health assessment. So when we think about signs, right, this is what we see as the healthcare provider. So that's going to be objective information. Examples can be the blood pressure, your vital signs, blood work, chest x-ray, things that we see as the healthcare provider. Symptoms are going to be subjective information that the patient tells us. Well, if the patient says, I feel nauseated, or it burns when I pee, right? Those are all symptoms, okay? And those are subjective. And whenever a patient gives us that information, we have to believe what they're telling us, okay? And we will document it exactly as the patient states. All right, let's now go to our stages of illness. Okay, stages of illness. So it's important to understand the stages of illness because we have to understand in a clinical setting, how does this patient present and what are the nursing interventions going to be for this patient as they are in the various stages of illness. And is there anything that we can do to prevent the progression? Or so that's kind of important for us to understand. So the 5 stages: incubation period, the prodromal period, the period of illness, the period of decline and the period of convalescence, okay? So let's take a look at this next slide because it's going to tell us, okay, what's going on in each of these phases. And let's think about some of the things that we can do as a nurse if we have a patient in these phases. Okay, so in the incubation period, this is right after the pathogen has entered the host, right? So the pathogen will start multiplying, and really this patient may be asymptomatic. They may be fine, right? So this is the incubation period, and the time frame kind of depends, right, on whatever that infecting organism is. Sometimes it could be 24 to 48 hours for an incubation period. Now, this prodromal period, this is when the immune system is like, hey, wait a minute, we have a bad guy, we have a pathogen, there's something that's invaded our body, right? We have to start fighting. And so that's when you're going to see the individual with maybe a fever, right? They start to feel malaise, right? And so the symptoms will maybe sometimes be mild. But this is where the immune system is starting to kick in, okay? Now, the next stage of illness is going to be the period of illness. It's like, okay, wow, I'm really sick. I have these symptoms. I have this runny nose, this achy cough. It feels like I've been run over by a truck, right? So the pathogen is actively multiplying during this time, right? The signs and symptoms are the most severe. So as the nurse, we may have to administer medication to treat that fever, push fluids to help them to stay hydrated, right? So these are all things that we need to think about during this, period of illness. Now, the period of decline, this is if the person's immune system has been successful, right, and they have been successful in fighting off this pathogen, the pathogen's number will start to decline. The signs and symptoms will become less severe. The patient may say, I'm beginning to feel better. I'm not 100%, but I might be at 70%, right? And so that's great. And we're still going to make sure that we're pushing fluids. Hydration is going to be important, right? As long as it's not contraindicated for this patient, and then still treating any symptoms that the patient may have. Hygiene is going to be important, hand hygiene, their own hygiene, changing their sheets, changing their clothing, right? And I want to emphasize that I didn't say this, but during the period of illness, they should really limit their contact with others, right? Uh, because they don't want to pass the pathogen on to others. Okay, so as the nurse, we will take our precautions, our universal precautions, and wear our gowns, our gloves, face masks, shields, whatever's necessary to keep us safe, and of course, practice that good hand washing. Now, during the period of convalescence, this is when the host, our patient, has recovered from the infection. So the pathogen is almost eliminated from the body, and the patient's like, okay, I feel like 98, 99%. Okay, so those are the stages of illness. And as you think critically, I want you to think about, okay, what is my role as the nurse if my patient is in each of these particular phases? Okay, so I like this chart because it tells us, okay, this is what should happen when the patient is in that incubation period and also the prodromal phase. They need to stay home. They need to stay away from other people. Okay, when they have their symptoms of being most severe, right? This is their period of illness. They definitely need to stay home. If they're not 100%, even though those symptoms are less severe, they should stay home. Okay. And during the period of convalescence, when they're almost 100%, they should stay home as well. Now, I know that with COVID, if we're COVID positive, the CDC guidelines are now saying, 5 days to quarantine, right, to isolate from other people. If as long as after those 5 days, the patient is asymptomatic, they may go out, and it's recommended that they wear a mask, right? So those are the things that we should be able to understand and to be able to educate our patients on. Okay, so let's talk about the levels of disease, right? And I feel like we're living this right now, right? So some diseases are relatively rare, right? And others can be more common. So when we think about something that is sporadic, it happens infrequently, it doesn't happen all the time. It's just, oh, once in a while it happens. An example of that is going to be rabies, right? And so we know that rabies can come if to humans if they are bitten by an infected animal, an animal that has rabies. Now, an outbreak is a sudden increase in the number of cases, right? And so it's a rise above what we would normally think in a specific area or patient population. So that is an outbreak. There's also a movie, I think it's an older movie called Outbreak. If you're interested in watching that, I'm sure it's probably on Netflix. Now, let's talk about endemic. Endemic refers to the constant baseline presence of a disease, right? So within a certain area. So something that is endemic, it's just we live with it, right? Because it's always there. It's kind of there, but it's not necessarily a problem, right? But we deal with it. And so influenza is one of those things that we know every year flu season comes up, right? Now, an epidemic, this is a sudden increase in the number of cases, right? So an epidemic. Now, the pandemic is what we are, living with when we talk about COVID-19. So this is an epidemic that has spread over several countries, continents, and affects much more people. And we know that this is true as COVID-19 has literally affected millions of people around the world. Okay. All right, so here's another kind of visual. So you can see endemic is kind of that baseline. We just live with it. We have vaccines, we wash hands, those kinds of things. If we're sick, we stay home. The epidemic is a sudden increase. There's larger cases in a particular region. And then the pandemic is around the world, okay? So I'm going to pause here to see if there are any questions. Okay, I don't see any questions, so we're going to go to the last portion of this discussion, and it's going to be the chain of infection. This is at the heart of nursing, the chain of infection. So the vocabulary terms you need to be familiar with is going to be the chain of infection, infectious disease, reservoir, portal of exit, mode of transmission, portal of entry, susceptible host, and herd immunity. So let's talk about this chain of infection. Okay, oops, sorry. So this chain of infection. So when we think about the spread of an infectious disease, it's kind of like this circle that it's formed by links of a chain. So as a nurse, I know that if I break any of the links of this chain of infection, that I will not be infected and my patient will not be infected. So here's the links. The infectious agent, what is actually, causing the illness, that pathogen, the natural reservoir, where does this pathogen hang out? The portal of exit, how does this pathogen get out, right? And the mode of transmission, is it by direct contact? Is it by indirect contact? Is it by a fomite? Is it by a vector, maybe a mosquito biting us, right? And then the portal of entry, how does it get into that susceptible host? Well, maybe somebody sneezed over a glass of water and now you drink that water. Or maybe someone sneezed on a pen and now you have that pen, you put it into your mouth, right? So this is the chain of infection. And if we break any of those links, then we can end or possibly make sure that our patients or that we do not become infected. Okay, so here's another kind of visual with this chain of infection. And so this is really helpful, especially if you are a visual kind of learner, right? Maybe you'll remember this circle of this chain of infection. Okay. All right, so we have the infectious agent, the reservoir, the portal of exit, transmission, portal of entry, as well as the susceptible host. Okay, so let's take a closer look at how we can actually break the chain. Okay, so these infectious disease process, it's everything is kind of linked together, right? So we need to break the chain as to not pass on this infection. So we have control measures. We can control the transmission. We can protect the portals of entry. So that means what that means is protecting the portals of entry. We know that our mucous membranes are portals of entry. So that's why we shouldn't rub our eyes, put our fingers in our nose or our mouth or our ears, because those are all portals of entry, right? And so increasing host defenses. So we can increase our defenses by vaccines, by eating healthy foods, right? Plenty of fruits and vegetables, getting enough hydration, getting enough rest, right? Those are all ways that we can increase our host defenses. And these are things that you should teach your patients, right? Okay, so this infectious agent is the pathogen. And so we talked about the different kinds of pathogens, right? And so let's talk about how these pathogens can cause infection. There's three factors to consider. So there's virulence, the ability to grow and to multiply, okay? And then invasiveness, the ability to actually enter the host, and then pathogenicity. That is the ability of this pathogen to cause harm in the host. These are all vocabulary words that your instructor, your microbiology instructor, is going to expect for you to know. So definitely, if you have any questions, you can go back to your classroom instructor, and I'm sure they're going to be more than happy to help you clarify anything that's not clear about these terms. And so sorry, I went too quickly. So how do we control pathogens getting into our patients or into our bodies, right? Well, we pasteurize food, we chlorinate water, we disinfect, right? We wash our hands, we keep things clean and sanitary, right? So when we look at the reservoir, when we look at this chain of infection, that's where the agent normally lives, grows, and multiplies. And reservoirs can be living or non-living. So if it's living, it's humans, animals. If it's non-living, it's soil, water, surfaces, and equipment. And remember, those non-living things like surfaces, door handles, doorknobs, those are called fomites. Okay, fomites. Okay, so control measures are going to be to eradicate the vectors, quarantine practices, and then regular testing. Okay, let's now look at the portal of exit. How does this pathogen get out of the reservoir, right? So for living, we know that we have blood, saliva, bodily fluids. And if the reservoir is non-living, it can be hygiene, right? Disinfecting surfaces, okay? So with these control measures is barriers, gloves, masks, quarantine practices, and good personal hygiene. Okay, so let's now look at the mode of transmission. So how is it spread from host to host? Direct transmission, physical contact, airborne droplets, and indirect is those fomites again, and vectors such as mosquitoes. So how do we break this chain or this link in the chain? Barriers, gloves, masks, quarantine, good hand hygiene, hand washing, right? So when we look at the portal of entry, how does this pathogen get inside our susceptible host? So broken skin. So that's why one of the first things, if we have broken skin, we immediately wash it with soap and water. Okay, because our skin is our first line of defense against injury and infection. We also look at the mucous membranes, blood, respiratory, digestive, or reproductive tracts. Those are all ways that those pathogens can get inside of our body. So these control measures, right, again, barriers, gloves, masks, good personal hygiene, right? So now let's look at the other link, the susceptible host. The susceptible host is that person that is at risk of infection. Now, the susceptibility depends on a number of factors, which we kind of mentioned before, right? So there could be natural barriers, genetics, the individual's immune system, do they have vaccines, and their overall health. Something that you may have noticed with COVID-19, those individuals that had additional comorbidities like hypertension, diabetes, autoimmune conditions, respiratory conditions, they were at an increased risk. Okay. And that is important when we look at this link. And okay, why do some people get really, really sick and some people don't? It's a combination of these things when they're infected, right, with COVID-19. And that's the example that we're using. Okay. All right, so how do we control this? Well, immunizations, medical treatment early and often, right? And some people, right, some patients do not have accessibility to medical care, okay? And also healthy lifestyle is going to be important. And what does that mean? Eating plenty of fresh fruits, vegetables, water, hydration is a key. Exercising, right? Those are all things that we can do to protect our immune system. Okay, let's now talk about, we're almost at the end. Let's talk about herd immunity. So you may have heard this, Dr. Fauci has been talking about it, right? When we were having our national discussions about coronavirus. So herd immunity is community immunity. When there's enough people that are vaccinated, right, then this is going to be better for the population as a whole, right? Because there's not the likelihood of the pathogen spreading is going to be reduced because there's going to be an increased number of people that are protected. Okay, so with herd immunity, the infected person will come in contact with people that's already immune, and so they will not spread the disease to a new susceptible host. Okay, and that's the whole concept with herd immunity. Something that they found, the CDC found, is that when children were living with adults who were vaccinated, they had less of a chance of actually becoming COVID-19 positive, right? So that was something that they found. Okay, so when we think about herd immunity, there is a threshold. And so this is the percentage of the population that must be immune. So to ensure that this pathogen will not cause a large outbreak. That was one of the things that they were trying to do as the coronavirus vaccine came out. They wanted everyone that could possibly become vaccinated to get vaccinated. Not everyone was vaccinated because some had vaccine hesitancy, right? And some people, because of their religious beliefs or because of other reasons, were not able to become vaccinated. So here's examples of a herd immunity threshold. And we see example one when we're talking about chicken pox, right? And it means that if 90% of the population receives that chicken pox vaccine, 10% will be protected. Uh, the remaining 10%, I'm sorry, unvaccinated, will be protected from a single person with chicken pox. So the idea is we want as many people as possible to become vaccinated against this particular pathogen because that will reduce the amount of outbreaks in a particular community. Okay. So here is a review of the chain of infection. I'm going to pause here to see if there are any questions. Okay. I don't see any questions, so I'm just going to share with you some of these websites that I found with microbiology. So there's Microbiology Cliff Notes. This is really cool because it takes you pretty much down the list of everything that you're going to see in your microbiology class. Because as your microbiology class progresses, you should be looking at diseases of each of the particular body systems. We do have 11 body systems, and there are going to be disease conditions of those body systems. So I also found a site, it's proprofs.com, and they actually have quizzes, microbiology quizzes. So that's proprofs.com. And if you don't have study notes, you probably do have study notes already, but I found a website from Houston Community College with some lecture notes from their particular microbiology class. All right, last but not least, I have a game of Kahoot. And so I'll give you some time if you can enter in your PIN, and let's see, we'll see if you can play this game of Kahoot as a review of some of the things that we've talked about today, and maybe some of the things that you probably already knew from your microbiology class, since this is week 4. Actually, it's week 5. So you should have a good understanding of this information. Okay, I'm just going to pause to see if anyone else is going to be able to join the Kahoot. All right, let's begin. This is our microbiology Kahoot. Question 1. Human beings are constantly interacting with microorganisms that can cause disease. Is this true or false? So it is actually true. We are constantly interacting with microorganisms that can cause disease, right? So, and that's okay. So let's go to our next question. Okay. So question 2. What diseases can be caused by the flu virus? Is it rabies, measles, chickenpox, or influenza? So it is actually influenza. So that's why it's called the flu virus for short, right? Influenza. Okay. Let's go to our next question 3. How many different kinds of illnesses can the flu virus cause? 1, 2, 3, or an unlimited number? So it's actually 1. That's true. So the influenza virus causes one condition, which is called the flu. Now, there can be different strains of influenza, though. Okay, all right, great job. Question 4. What is in a vaccine? Is it medicine to fight microorganisms? How in the world should I know? I'm just a kid. Some kind of voodoo serum, or weakened or kill parts of a virus? So it's actually weakened or kill parts of a virus, so that way the body could recognize them, right, and develop an immunity to it. Okay. All right, question 5. Flu vaccine can actually cause the flu. True or false? And that is false. It does not cause the flu. Okay, great job. Question 6. Which of the following microorganisms is the smallest? Bacteria, virus, sorry about that, protist, or fungi? Okay, so the virus is actually the smallest. Okay, the virus is actually the smallest. And remember, the virus is a non-living substance. Okay, the organism in this picture is what type of microorganism? Is it a virus, a bacteria, a protist, or a fungi? It is a protist. Okay, very good. Okay, we'll continue. Question 8. Which of the following variables does not mean the same as the others? Measured, responding, changed, or dependent? Okay, so changed. Okay, changed. Measured, responding, changed, or dependent. So changed does not mean the same as the others. Okay. Question 9. What type of treatment would be best to fight off a bacterial infection? Ibuprofen, vaccine, antibiotics, or creams or powders? Yes, that is correct. Antibiotics will fight off bacterial infections, okay? So antibiotics should only be given for bacterial infections. Question 10. Which body system protects us from pathogens like viruses and bacteria? Is it the muscular, immune, endocrine, or circulatory? Yes, it is the immune system. Excellent. Okay. Question 11. Which of these is best to prevent a viral infection such as the flu, chickenpox, or measles? Antibiotics, ibuprofen, creams, powders, or vaccines? Yes, vaccines. Okay, question 12. Which pathogen causes the illness shown in this photo? Streptococcus, Salmonella, Plasmodium, or HIV? So that looks like a really bad sore throat. Strep throat. That's right, Streptococcus. Okay. All right. Question 13. What traits do scientists use to classify protists? Their color, their size, how they move, how they eat. Okay, yes, that is correct. How they move is how they're classified. Okay. So question 14, about what percent of bacteria are actually harmful to humans? 1%, 10%, 40%, or 99%? A hint, it's going to be a small percentage. So yes, only 1% of bacteria are harmful to humans. And we actually have bacteria that's all around us, all inside of us, on our skin. So if you're throwing up after eating an undercooked hamburger, you were probably visited by Salmonella bacteria, influenza virus, Taenia pedis fungus, Streptococcus bacteria. Yes, Salmonella bacteria, right? So that's why we should properly prepare our foods. They should be well cooked. 16. What type of disease is not contagious but can spontaneously start growing in our bodies? Okay, influenza, rabies, cancer, or athlete's foot. It is not contagious. Yes, and it is cancer, and it can just spontaneously start growing in our bodies. Okay, very good. Question 17. If an infection spread through 4 rounds of people, how many people can get sick? And this is a math question. Okay, that is correct. So yes, 16. Okay, 16 people could get sick. Okay. All right, so the ability of your body to avoid infection and disease by destroying pathogens is called resilience, resistance, immunity, or agility. Yes, it is immunity, right? So that is our immune system that protects us, right? Once those pathogens enter our bodies. Okay, question 19. What type of treatment would you give to a person with this disease? Whoa, what's going on there? Vaccine, antibiotic, antifungal cream or powder? Oh, vitamin C, that's right, antifungal, because that's tinea pedis, right? That is athlete's foot caused by a fungus. Okay, bacteria like Staphylococcus that can survive exposure to antibiotics are called tough as nails, anti-medicinal, or antibiotic resistant, or Aunt Rhody. So it is antibiotic resistant. Okay, very good. All right, question 21. Which antibacterial product on the disc worked best? The one on the right or the left? So this is a petri dish. So which one actually has the most effective against bacteria? And it's going to be one. What you may have noticed on that petri dish on the left is that there was an area right around that white dot that did not have any bacteria growing at all, right? And so that's the antibacterial product that worked the best, because the other slide on the right was completely filled with colonies of bacteria. Okay, question 22. Which of the following two pathogens do not have a nucleus? Protists, bacteria, fungi, or viruses? So there's going to be two answers, so you can just choose one. They do not have a nucleus. Okay, that is correct. So the bacteria and virus, they do not have a nucleus. Okay, question 23. What kind of action listed below is it least likely to spread viruses and bacteria? Coughing towards someone, sneezing on someone, waving to someone, using the stair railing. Yes, so waving at someone is least likely to spread, right? So just wave at a distance, okay? All right, question 24. Which group of pathogens can only reproduce by hijacking a cell? Viruses, bacteria, protists, fungi, and that is correct. Viruses, okay? Excellent. Okay, so question 25. What is the most important thing you can do to reduce your chance of getting any infection? Cover your cough, wash your hands, use a Kleenex, use Clorox wipes. Yes, washing your hands, right? Florence Nightingale would be so proud. So in first place, well, in third place, we don't have anyone. In second place, we don't have anyone. And in first place, we have Erica, and here is her confetti parade. So I am very proud because Erica, my daughter, was able to get 19 of these 25 questions correct. All right, so Erica, this is your confetti parade. And for my nursing students, hopefully this review was helpful to you. And I'm going to pause for any questions. If not, thank you so much. Have a great day.